Hello, welcome to my presentation. My name is Lily Nelson, and I am presenting on the Health Policy Analysis Part 2. So my policy is Bill S. 1841, Mental Health Services for Students Act of 2021, and it is a federal bill, meaning it spreads across America if it is passed. It's not just a New York State thing. It is a bill to amend the Public Health Service Act to revise and extend projects related to children and to provide access to school-based comprehensive mental health programs. It's sponsored by Tina Smith, who is the senator of Minnesota, and there are 10 other co-sponsors for the bill. 9 of these co-sponsors are Democrats, as is Tina Smith, the sponsor, and 1 is of the Independent Party. The goals of the policy: to expand project-aware state educational agency grant programs to give more mental health services to children or adolescents, and to provide training to better the health and academic standing of children who are at risk of attaining a mental health issue or already have one. The goals continued are providing training for the parents, guardians, siblings, and involved members of the community to improve the mental health of these children or adolescents with mental health trauma, disabilities, or mental health disorders, providing evidence-based screening to identify mental health disorders in children. I think it's important to provide more evidence-based screening to get to the root of the mental health disorder before it progresses over years for children, which is why this bill is so important. The policy history and development: it was passed as 2 bills in the 115th and 116th Congress in 2018 and 2019, and died before it could be passed. So we're hoping that my bill, Mental Health Services for Students Act of 2021, is passed through. I think it's important to understand that Tina Smith has really tried to pass this bill, and she's not giving up, which is great, because I want to see this bill pass through. The interested actors and players: the formal actors are Tina Smith, her co-sponsors, the U.S. Senate, the Senate Committee on Health, Education, Labor, and Pensions. It was introduced to them as well, and they passed it through, but it hasn't reached farther than them. The informal actors include myself, other U.S. citizens who have advocated for this bill, the Democratic Party, and the Independent Party, because the co-sponsors belong to those parties. Policy analysis: the obstacles: 2 previous versions died in Congress. It must be passed through Senate, the House of Congress, and then passed by the President of the United States to become a bill. There are various forces acting on the bill. Republicans outnumber the Democrats in the Senate, so it's hard to pass it through there. The political culture: the priority is the economy, so people, American citizens themselves, are more focused on bills that pertain to the economy, especially during COVID-19. They want to see lawmakers really focus on giving them support in that area instead of mental health for students. And so they're influencing what gets passed and what doesn't get passed based on priority. The Democrats outnumber Republicans in the House of Congress, which is good. So because they have more rapport with each other, they'll be able to pass it further than if it were Republicans having the majority in Congress. Strategies of proponents: the Democratic senators have more political power in the House of Congress. The Democratic members have more rapport with one another, and President Joe Biden is a Democrat, so they might be able to convince him to pass it through since they have the similar political party and affiliation. The policy's impact on OT: so it would provide more mental health services in schools across America if it's passed, possibly lead to more OT involvement in the mental health of students. If it's not passed, there will be no impact on OT involvement in school settings. It is important for OTs to expand the scope of practice to include more mental health services in school districts to make their treatment as client-centered as possible. They could treat children with anxiety or depression and prevent these disorders from progressing. And that is all. Thank you for listening to my presentation. Here are my references. Thank you.